conflicts are tend to be long and go on for much longer than, let's say, we think of a war, having a discrete start and a discrete endpoint. Oftentimes, the post-conflict period merges with the conflict period, and that can last, years, if not decades more. And especially when there's a conflict that's, regional or local or limited to parts of a country, I think it's important to remember that the folks who are facing that are facing the violence and the insecurity for far longer than it's in the news. And part of that, part of thinking through the best ways to manage that from a humanitarian standpoint is to really think about transitions. Oftentimes, I think when there's initially a conflict or a war, there's a lot of engagement, there's a lot of attention, and a lot of funding, to be honest, that goes into, you know, finding health workers, finding humanitarian aid workers, making sure the news is staying on it, but really transitioning that into a space where there it goes back to a community that's engaged, local ownership, and things like that will take a much longer and more thoughtful process. So this isn't uh, I don't know if this is going to be the best example, but I'll give you an example. I was in Haiti in 2010 after the earthquake, and it was it was a really fraught time, and obviously everyone was in trouble. And so it was really great for a short amount of time that health workers, physicians from the United States were able to go down and provide services. But the error there, I think, is even though the health cluster system started, there wasn't really an overlap between the American health workers that were going there to help and the local health workers who maybe they couldn't work for a few weeks or months while they figured out their own system, their families, their buildings. But transitioning from this American humanitarian system back to local ownership of the health system, it was really rough. And for a long time, there were parallel health systems. And unfortunately, the one run by international organizations often had American or white doctors and had free care. And the one run locally, this is their livelihood, so they had to charge for care. And so with everything going on there, it was really hard for local health workers to build up and provide the level of service that they could have had the international community sort of transitioned well or engaged with them earlier on. So that's one example I wanted to give of why I think transitions are really important in the conflict to post-conflict setting.